Welcome to the presentation for our paper, Learning Patient Rotation Using Synthetic X-ray Images from 3D CT Volumes. I am Raina. In this project, we focus on chest X-ray, as chest X-ray is one of the most frequent acquired medical images. But for immobile patients, only AP chest X-ray could be performed, where the detector is placed behind the patient on the bed. The current challenge for AP chest X-ray is that it is susceptible to patient's rotation due to illness or medical instruments, which would change the lung density and trachea position, thus reducing diagnostic confidence. We can use carothoracic ratio or clavicle spine distance to determine if a chest X-ray is rotated, but it requires clinical expertise or hinder clinical workflow. Therefore, we need an automatic algorithm to inform the technician if and how the re-exposure should be. For deep learning training, we know that curation of large-scale annotated clinical data is challenging due to scarcity or ethical issues. Previous studies leveraged synthetic generated data to train AI models, ranging from image data to test for quality language data. In X-ray, we can forward project 3D CT volumes to 2D synthetic X-ray, which are also called digitally reconstructed radiographs, to train AI models. In the next slides, I will give you some downstream examples. This includes airspace quantification in COVID patients and segmentation of spine vertebra. Also, 3D CT data and a CAD model of surgical tool were forward projected to 2D and trained for an object detection in interventional imaging. Therefore, our aim is to train a model with synthetic non-rotated and rotated chest X-ray from real CT data, so to learn features in patient rotation without the need for annotations. For the synthetic data generation, we use 80 photon counting CT dataset, each with around 1,000 slides. We forward project the 3D data to 2D X-ray by ray tracing. Here we can see the simulation setup. With a center projection at 0 degree. To simulate patient rotation, we projected the 3D CT volume with an angle alpha in the range of -20 degree to +20 degree, with a step size of 2 degree. A total number of 1,680 synthetic chest X-rays were simulated. We used DenseNet 1-to-1 to predict the degree of patient rotation, where our final layer activation function we use hyperbolic tangent function so as to preserve our sign as our target labels consist of negative and positive values. This is our training setup and hyperparameters. Our evaluation includes regression fit and blind assessment plots, which indicates a good learning of features to detect patient rotation. There are also no bias and systematic error in the synthetic data generation and training. And so the main key takeaways for our paper is that we leverage synthetic 2D images generated from the physics-based projection of real 3D data. And we also successfully trained the network to quantify the internal patient rotation in chest X-ray, as originally limited by the availability of rotated and labeled chest X-ray. For technical details and results, please feel free to refer our poster and paper. I'm looking forward to your questions and discussion, and wish you have a nice MIDL conference. Thank you.